Are you turning 65 and not sure exactly what that means for Medicare? We've got you covered. Welcome to Empowering Your Future, a Banker's Life podcast.
Welcome to the very first episode of Empowering Your Future, a Banker's Life podcast. I'm your host, Jonathan Lawson, insurance professional and dedicated Colonial Penn and CNO employee. And today, I'm joined by Carmella Rose, a Banker's Life agent, to discuss the topic of turning 65 and what that means for Medicare. Now, first, this is just a reminder that Banker's Life and its agents are not connected or endorsed by the U.S. government or the federal Medicare program. Now, getting back to the topic at hand, we know this milestone can feel overwhelming. There's a lot to consider, and it's not always clear where to start. So we're breaking it down in a way that's easy to understand, providing the high-level guidance you need to feel confident and informed. Carmella, would you like to give a quick overview of your role at Banker's Life?
Sure, Jonathan. Thank you. So I have been a financial professional with Banker's Life since 2022. I've been licensed in this industry in 2016. I love what I do. I'm able to give education and help guide people through some of these harder areas of retirement.
Well, that's great, and thanks for that. Carmella, I'm so glad we're chatting today because there's a lot of confusion out there about what turning 65 means for Medicare. Can you give us the lowdown on what people turning 65 should know?
Sure. So one important thing to remember is that turning 65, it's not just your birthday. It's a decision point. So when you turn 65, you enter what we call your initial enrollment period, or IEP. Now, this is a 7-month window, starting 3 months before your birth month, ending 3 months after your birth month. So for example, if your birthday was in July, your IEP would be from April until October. It's really important to know that missing these enrollment periods could lead to penalties, so you want to make sure that you mark your calendar.
And just to clarify, Medicare doesn't automatically enroll you unless you already receiving Social Security benefits. Can you touch upon that briefly?
Sure. So correct. You do want to make sure that you apply for your Medicare to avoid any gaps or late enrollment penalties. Now, to answer your question, if you are drawing your Social Security benefits and have been for at least 4 months, you will be automatically enrolled in the A and B original Medicare. And just make note, I'll talk about this later, but original Medicare is combining parts A and B. So you want to make sure that you look out for your card, which will arrive about 3 months before your birthday.
Okay, great. Thanks for clarifying that. So Carmella, walk us through what people can enroll in during the IEP.
Sure. So there's a few things you can do actually during this enrollment period. First is your Part A. This is known as hospital insurance. This is what's going to cover your room and board as a patient, whether you are at a hospital, skilled nursing, some hospice, and possibly some home care. And then we have Part B. This is your medical insurance. This is the portion that's going to cover your outpatient care, doctor's visits, preventative, durable medical equipment, and this does come with a monthly premium, which is based on your income. As I mentioned before, the term original Medicare refers to parts A and B combined. And then we have Part C. Now, this is called Medicare Advantage. This is offered by private companies as a replacement plan for your original Medicare A and B. The benefits are required to at least be equal to those of original Medicare. And sometimes on these private sector plans, they can offer some additional benefits. The fourth is your prescription drug plan, or what we call Part D. Now, this is optional, but it is important that if you take daily prescriptions, that you have a plan. Make a note that in 2025, the out-of-pocket cost for prescription drugs was $2,000. So that's the most that you'll pay. And some people won't even pay that, depending on the drugs that they take. So it is important to note if you don't enroll in a Part D for any reason, you could face penalties later. And lastly, we have our Medicare Supplement or Medigap plan. Now, these plans help fill the gaps that original Medicare can leave you with, and those at unlimited out-of-pocket costs not paid for by original Medicare A and B.
Wow, that's a lot to take in.
Mm.
But it's helpful to know what each part covers. Even though we're not diving into specific plans, understanding that structure helps people know what questions to ask when they're ready to explore their options.
Mhm.
Now, Carmella, what if you miss that initial enrollment period? What can people do if they miss this 7-month window?
That's a great question, Jonathan. If you don't sign up during your initial enrollment period and you don't qualify for what we call a special enrollment period, to give you an example, this would be if you were to lose your employer coverage, whether it's your place of employment or a spouse's, you would have to wait until general enrollment period, which starts January 1st through March 31st. During this period, you can enroll in your Medicare A and B. And keep in mind that whatever month you apply, those benefits will not start until the following month. So for example, if you would enroll, let's say February, those benefits would begin on March 1st. And these guidelines and enrollment penalties, if you do miss out, they're enforced by the federal government through the Centers of Medicare and Medicaid Services. So you want to make sure that you'll do your research and not miss that 7-month window.
Okay, that's good to know. So everyone keep an eye on the calendar. Do what you need to do so you don't miss that crucial 7 months. Now, let's dive into some of the most common questions people ask when they're approaching 65. Carmella, what's one of the common questions you hear a lot?
Sure. So one big one that I receive a lot is, do I have to enroll in Medicare if I'm working? And the answer is not necessarily. If you have credible coverage through your employer, especially if your company has 20 or more employees, you actually have an opportunity to delay your Part B Medicare without a penalty. But it is important to check with your HR to make sure that you understand if your coverage qualifies for that delay.
Wow, Carmella, another one that I've heard a lot of, especially from my family, is, will Medicare cover everything I need?
That's a good one. The short answer, Jonathan, is no, unfortunately. But original Medicare Parts A and B, they cover a lot, but not everything. So things that original Medicare do not cover are dental, vision, hearing aids, and long-term care insurance, which is a really big one. That's why some people actually will explore some additional coverages, but it is important to make sure that you know your specific needs and choose based on what's best for you.
Awesome. Now, before we wrap up, can you share a few takeaways and tips for listeners who are approaching 65?
Sure. So just a few things to keep in mind, okay? Start early. Make sure you're doing your research about 6 months before your 65th birthday. Use official resources or ask your banker's life agent. You can visit Medicare.gov for some accurate and up-to-date information, or you could just ask your banker's life agent, and we're happy to help answer some of these questions for you. Talk to your employer. If you're still working and you want to understand how those benefits are going to correlate with Medicare, make sure you sit down with someone in HR and get the information that you need. Keep your documentation. This is a big one. When you're communicating with Medicare and Social Security, make sure that you're noting their name when you spoke with them, just in case you do have to revert later to these times that you had correspondence with them. Don't miss the deadlines. These can lead to penalties. Not only does your Part B have a 10% penalty for every 12-month period that you go uninsured, it can also lead to gaps in coverage. And also, if you don't enroll in your prescription drug coverage, there can be penalties which both will stay with you for life. And don't overlook the costs. While Medicare does provide a substantial coverage, it's not free. So make sure you familiarize yourself with the premiums, the copays, deductibles for each part of Medicare, and make sure that you understand so you can choose what's best for you. And above all else, ask questions. Don't be afraid to reach out to somebody or a trusted source. It's important to get educated on your specific situation because everybody's different. Everybody has different needs and priorities and health history. And again, reach out to your banker's life agent, and we're happy to answer these questions for you.
Thanks so much, Carmella. This has been incredibly helpful. For those of you listening, remember, turning 65 is a big milestone. But with the right information, it doesn't have to be stressful. We'll be covering more topics in future episodes, so watch this space. In the meantime, check out our Bankers Life blog at www.bankerslife.com/insights for more resources. Thank you for joining us today, and until next time, be empowered.